In our community, there is a serial killer invading our homes and patrolling the streets at this very moment. This killer takes thousands of lives every year and does not discriminate between gender or age, and everyone's at risk. However, there is one major weapon that we have to fight back against this monster, but we have kept it locked up and have let the deaths continue. This killer is a sexually transmitted disease. I know that this story may seem a little fantastic, but it is the truth and describes the real issue that our country is facing today. The threat that we are fighting back against every day is an overload of sexually transmitted diseases that are very dangerous and even deadly. The easiest solution to this issue is a change and growth in the sexual health education that we offer both in schools and in our community. In today's society, many health complications arise due to the lack of sexual education in the United States, and therefore we need to carry the torch and help prevent this issue from continuing through better organized educational programs. Now that you know the threat exists, let me explain a little bit more about its danger. STDs are a serious epidemic that is quickly taking over our country. According to studies done by the Center for Disease Control, currently there are 20 million new infections every year and 110 million infections total. The CDC also found that each year almost 7,000 people are killed from HIV alone, and that is just one of many deadly diseases. STDs do not only affect one's physical health, but rather all aspects of their lives. When someone is diagnosed with an STD, they often go through mental failures as well as physical, such as depression, anxiety, and suicidal thoughts. When other people find out that someone has an STD, they are often ostracized by friends and family. STDs are also expensive. According to the CDC, Americans spend $16 million a year in medical expenses caused by STDs. Another statistic that the CDC found is that 15 to 24-year-olds make up half of the new cases of STDs every year. As the main group continuing this worldwide issue, it is our responsibility to take action and assist in fighting back to save our population by ending the spread of STDs. Now that you understand the danger that we are facing, allow me to propose a means of solving this issue. To bring an end to the tragic outbreak of STDs in our country, we need to set up a largely improved system of education. First, we need to implement these programs in our schools and in multiple grade levels. We need to have counselors and teachers trained to be prepared to give well-educated answers to students with questions. There also needs to be a required sexual education course in middle and high school because children go through different sexual changes in each stage of life. Next, we need to create community classes that can teach parents how to talk to their children about sex and the changes they will undergo during puberty. Another major change that needs to go along with these programs is a shift in our culture towards a more accepting atmosphere. We need to help our children feel more comfortable asking questions and not feel as if curiosity is something that will get them in trouble. We also need to enforce in our children that if they are not comfortable speaking to their family about sex, then it is safe to speak to administrators at school, who are there solely for the purpose of helping them adjust to their changes. You may be concerned as to how this simple change could stop a whole epidemic, but it has been proven by other countries that this small change can make a large difference. In a study done by the Guttmacher Institute, they looked into sexual education related to STD and pregnancy rates in different countries around the world. The study found that in Sweden there is a much more organized sexual education system. There are schools, programs, community offices, and local counselors that are enacted with the base purpose of spreading sexual awareness. Counselors not only teach, but they also provide contraceptives to help ensure that children they speak to will try and practice safe sex. The community as a whole also is shown to be more accepting of sexual activity and questions of adolescents, which makes them more likely to speak to adults about their issues. The study also found that Sweden has had a much lower STD rate compared to the U.S. Looking at just the STD gonorrhea, in Sweden there is only about 1.8 registered cases per 100,000 a year. However, in the U.S., there is a recorded 571.8 reported cases per 100,000 a year. Since you now understand the plan, allow me to show you what can happen if this is put into action and if it is not. Imagine first that these programs and safe practices are enacted in our country. Instead of living for years with painful ulcers and rashes, our children grow up to be strong and happy, which creates a longer living population. Babies are no longer born with passed-down diseases that can cause them to be born blind or have to live off medication their whole life. And our children grow up feeling comfortable talking to their parents and therefore have a better time undergoing the changes of puberty, develop better relationships with their parents, and most importantly, have a future without STDs. Now take a moment and think about the future will be like if we continue down this dark and dangerous road. Many of our descendants do not live through their 20s because of HIV and AIDS. The ones that do live and reproduce pass on their diseases and pain to their children, and soon enough the numbers have not just doubled but tripled. And our country cannot function with STDs as the number one cause of death, taking thousands of lives a day. I hope that this has helped you see how dire the situation really is and why it is time for us to act now. Now that you've seen what a dark future we have in store if this issue is not corrected, it is time to act back against it. As before mentioned, we are the age group that is still causing this dangerous epidemic. Also, we are the next generation to have children, and therefore it is our responsibility to teach our children what they need to stop to keep this from occurring in their adolescent years. We should go to our community leaders and request these educational programs to be installed in our community and in our school systems. This is our chance to show the world that the United States will not let something as simple as unsafe sexual practices bring us down, and that our generation will not continue to make the same mistakes that others have before.